Stroke Awareness Month, so we want to invite in our medical expert, Dr. Cedrek McFadden, to give us a better understanding of strokes, the risks, and the relationship to COVID-19. Dr. C, thanks so much for being here.
Thanks for having me.
So the CDC says that 3 out of 5 people are aware of all major stroke symptoms. That's not everybody, so
That's not everyone.
Clue us in.
So the big ones you have to remember are the acronym FAST.
Okay.
It stands for facial drooping. If you've noticed that obviously you have a numbness to one side of the face or there's a drooping to the side of the face, that could certainly be a sign or a symptom. A simple test you can do is ask a person to smile. Is the smile asymmetrical? Is it uneven? The next symptom to pay attention for is arm weakness. Is there numbness to one arm? Or is there weakness to it? A simple test is asking you to raise your arms and see if one arm drifts down. Okay. And the last one is speech. Okay. You know, is there slurred speech? Can you understand what they're saying? Or is there some confusion? Simple test, asking them to repeat a simple sentence to see if they can give that. If any of these signs are present, it's time to call 911, whether they go away or not. Call 911, get to the hospital.
Okay, I like that. FAST, F-A-S-T, so that was face, arms,
and speech, and time to call 911.
Time is really of the essence, isn't it?
Yes, in strokes, time is brain. Many of the damages that are produced are resulting from the death of brain cells that don't get enough blood flow. Either the blood is disrupted from a blockage in like ischemic strokes or hemorrhagic strokes where there's a rupture of the blood vessel. Either of these cases causes a disruption in the blood flow and death of brain cells that can produce long-lasting troubles.
According to the CDC, every year strokes kill twice as many women as breast cancer. This is really prevalent in our society.
It's present in our society. Women, African Americans are affected by it. Some of the risk factors for strokes are things like diabetes, heart disease, and these are symptoms that we're seeing a lot in women, in African American. And we're also seeing it in COVID patients as well right now, especially those 30 and 45 years of age.
Okay, explain that a little bit more about people are going in for COVID-19 and realizing that they're seeing some of these symptoms in them.
They are.
That they may not have known of?
They are, and they may not have any symptoms or risk factors for them. Many researchers are seeing these stroke patients and assuming they're related to either blood problems that lead to clots all over the body. And so these clots can travel from one area of the body to another and creating these symptoms that many of these people don't even expect that they should be having, but they're having them.
So are there things that we can do to keep strokes away, healthy lifestyle, I would imagine?
There absolutely are. So number one, know your numbers, your blood pressure, your blood sugars, your cholesterol. Keep them within normal limits. If you need to lose weight, lose weight. If you smoke, quit smoking. If you don't smoke, don't start. Yeah. And also making sure that you have control of any heart-related issues like atrial fibrillation, making sure those medications are making that less of a risk factor for other signs of stroke.
Yeah, my grandmother was a smoker. She had a stroke. It really impacted the quality of her life. And you say you should call 911. That's really what you should do.
You should call 911 and you should seek medical help. Even if the symptoms go away, there are things called mini strokes or TIAs where the symptoms go away within 24 hours. This is not even something that you should ignore. Even if that happens, still call 911, get the attention that you need.
Okay. All right. Dr. C, you're going to join us again at 5 o'clock tonight for some viewer questions on COVID-19, as he always does on Thursday. Thanks so much.
Thank you.
Appreciate it. And coming up on Carolina's Family at 4, we'll have much more news. Stay with us.